Hello, I'm Dr. Moon-Kyu Kim. I'm working at Gyeongbuk National University Hospital Hair Transplantation Center in Daegu, Korea. Today, I will introduce INNUT, the KNU multi-implanter. I have been involved in the development of INNUT, and I'm working as a consultant for the company. Introduction. Implantation is an important part of hair transplantation surgery, and it takes as much as half of the total surgery time. Using an implanter has many advantages, and the use of implanters has become more popular since the development of FUE. The advantage of using an implanter is faster and better survival. However, it also needs learning time to master the technique. Until now, the most efficient way to use a single implanter is to place a deliverer between loader and physician. But it needs one more manpower, and there are possibilities of dropping the implanter or sharp needle injury. And it also requires considerable concentration and teamwork. The INNUT multi-implanter was developed to make the implantation more efficient and increase the speed. Number 2, how it works. INNUT multi-implanter was created by the joint research of the Gyeongbuk National University Hospital Hair Transplantation Center and the Ode Metal Company's medical device team. INNUT multi-implanter enables the placement of 10 grafts at a time. The needle-containing cartridge is continuously rotated and automatically exchanged, so the procedure can be performed more quickly and more precisely. How to roll the grafts? To roll the grafts, holding the device with one hand and holding the grafts using forceps with the other hand, and slide into the slits of the needles one by one. Number 4, how to place grafts. The way to use device is divided into 5 steps. Number 1, grabbing the device. Number 2, stick the needle into the skin. Number 3, remove needle to place hair follicle. Number 4, remove nozzle from scalp. Number 5, rotate cartridge and change the needle. INNUT multi-implanter changes the needles automatically, so it enables faster grafting than any other method. INNUT multi-implanter shortens operation time and reduces fatigue of both the physician and the patient. Number 5, what parts it has. This figure shows what parts the INNUT multi-implanter consists of. Number 6, how to change needles or other parts. How to replace cartridge. Number 1, remove nozzle and combine cartridge cover. Number 2, remove rear cap, pusher, and cartridge. Number 3, insert new needle cartridge. Number 4, combine the nozzle. Number 5, combine stopper. Number 7, how to sterilize. The cartridge containing 10 needles is provided in a sterilized state for single use. The body should not be autoclaved, and it can be sterilized with EO gas. Pros and cons. The advantages of using INNUT multi-implanter are many. Number 1, faster. It can place 10 grafts at a time, so you can easily place over 1,000 grafts per hour. Number 2, save surgical assistant manpower. It no longer needs a deliverer, so you can save one manpower. Number 3, safer. It can reduce needle stick injury that can occur during the transfer of the implanter. Number 4, reduced surgical time is good for patients. By reducing implantation time, the anesthesia time and the time for the hair follicles live outside the body is also shortened. So it is also good for patients. The disadvantages of using in-root are: number one, learning time. In-root multi-implanter is thicker than single implanter, so you need time for adaptation. Number two, cost. Yes, it also needs cost. Number 9, average cost. Usually, 3 devices are needed for each surgery. It costs $40 per cartridge, and it means $120 per operation. Other housings can be reused after cleaning and sterilization. 잘 던져줘야 되고. 바늘 때문에 좀 애를 먹은 적이 있었죠. 이 바늘 팁이 굉장히 크리티컬 하거든요. Take-home message. In-root, the KNU multi-implanter is revolutionary in hair transplantation. You can easily place over 1,000 grafts per hour. Thank you very much for your attention.